everyone. My presentation focuses on ethical oversight in clinical trials involving adults with cognitive impairments such as dementia and Alzheimer's disease. This is a critical area of research because these individuals face unique challenges in understanding and consenting to participate in studies. Ensuring their protection and autonomy is essential for ethical research practices. This study centers on ethical oversight in clinical trials involving adults with cognitive impairments, such as dementia within the United States. Adults with cognitive impairments represent a vulnerable population in research, as they often face significant challenges in understanding study procedures and providing informed consent. These challenges highlight the need for robust protections to ensure their rights are well-being are safeguarded throughout the research process. IRBs play a crucial role in managing ethical concerns and overseeing the protection of these participants, ensuring that research protocols adhere to established ethical standards. The primary goal of this research is to design a study that addresses these ethical issues, ultimately aiming to improve the inclusivity and protection of cognitively impaired adults in clinical trials. By focusing on these objectives, the research seeks to contribute to the development of more ethical and effective practices in clinical research involving these vulnerable populations. The specific research question guiding this study is how do institutional review boards, or IRBs, ensure ethical oversight in clinical trials involving adults with cognitive impairments, and what challenges do researchers encounter in obtaining informed consent from this population? This question is important because it addresses the need to safeguard vulnerable participants and to improve the quality and integrity of clinical research. The importance of this topic includes adults with cognitive impairments represent a significant and growing population in the United States. With nearly 14% of adults affected, it is vital to ensure that research involving these individuals is conducted ethically. Addressing this topic helps prevent exploitation, promotes autonomy, and supports the development of more inclusive research practices. Recent literature highlights several key issues in ethical oversight for cognitively impaired adults. Gregis and colleagues conducted a systematic review of international policy guidelines and found inconsistencies in ethical standards, especially regarding informed consents and surrogate decision makers. Gordon's quantitative analysis of IRB records revealed frequent ethical challenges, including difficulties in obtaining valid consent and ensuring participant comprehension. These studies underline the need for clearer, harmonized guidelines to protect this vulnerable population. To investigate the research question, I propose a mixed methods approach. The qualitative component will involve interviews with IRB members and researchers to explore their experiences and perspectives on ethical challenges and consent procedures. The quantitative component will analyze IRB documentation to quantify the types and frequencies of ethical issues reported in clinical trials involving cognitively impaired adults. This approach is grounded in pragmatism, which values the integration of diverse data sources to address complex ethical questions. The rationale for the design choice is due to a mixed methods design is appropriate because it allows for a comprehensive understanding of both the subjective experiences of stakeholders and the objective trends in ethical oversight. By combining qualitative and quantitative data, the study can identify best practices, highlight areas for improvement, and inform policy recommendations for protecting vulnerable participants. Several ethical issues may be addressed in research involving adults with cognitive impairments. Obtaining valid, informed consent is challenging and requires ongoing assessment of decision-making capacity. When participants cannot provide consent, surrogate decision makers may be involved, and protocols must ensure that surrogates act in the best interest of the participant. The study will comply with federal regulations and IRB requirements, including ethical training for researchers and regular review of consent procedures and participant safeguards. In conclusion, ethical oversight in clinical trials involving adults with cognitive impairments is essential for protecting vulnerable participants and enhancing research integrity. By employing a mixed methods approach, this research aims to provide a comprehensive understanding of the ethical challenges faced by researchers and oversight bodies. Strengthening ethical oversight will ensure that cognitively impaired adults are treated with respect and dignity in future clinical trials. Thank you so much, and if you have any questions, please make sure to email me at my student email address. On this slide, you will see the references for the studies and sources cited in this presentation, formatted in APA style.